Hand hygiene is a very important task to undertake when doing a simple wound dressing, or any dressing at all. In this video you will see me washing my hands very thoroughly and making sure that there are no germs left on them. Make sure to rub soap in between your fingers and on the skin of your arms and hands. Rub in between the creases of your fingers to make sure there are no germs in there. Begin to wash off the soap off of your hands by putting your hands and arms underneath the running water. Use your hands to rub off the excess soap. Continue washing your hands until there is no soap left. Okay, so I'm going to teach you how to do a simple wound dressing today. So these are just simple materials I'm going to use on you. So it's just a normal bandage, and then I've got a wrap bandage to go around, and then these are just some tissue to wipe up the dirty wound. Okay, so I'm going to wipe from clean to dirty. So you go around the wound like this and bring it to the middle, and then once you're done with that, throw that straight into the bin, and then you get the next one and do the same thing, and dip it in some normal saline if it's around as well, which is good to help clean. So from clean to dirty again, and throw that away. Then you're going to want to get some dry paper and just dab that very lightly around. Then after you've done that, then we'll open up this. So another thing I forgot to mention, that you should wear gloves throughout this as well, but I don't have any on me today, but every time you do a wound dressing you should be wearing gloves. Do you have any questions?
How many times do you have to clean the wound before you dress it?
It varies on what the wound. If the wound's very dirty and oozy with pus and stuff, then a few times. But if it's a clean wound, then you only have to do it maybe once or twice. Alright, so now that the wound is clean, I'm going to just as you would normally at home, just take off the rubbish and put it straight over the wound. Make sure there's no air bubbles when you put down the sticky side of the bandage, like that, because you don't want to get it wet, and also it just protects it from getting dirty. Alright, and then for extra protection and just put pressure on the wound as well so you don't get any bruising, you just go around, up and down, and put pressure while you do it, so pull it nice and tight like that. And if this is a very infectious wound, then you should do this in the aseptic non-touch technique, but because this is a very simple wound, I'm just doing a simple wound dressing on you today. So just go all the way around. You don't need one of the metal clips because you can just tuck it into the side like that. Alright, so once you're done with everything, you get all the material and throw it straight in the bin. Wash your hands and then document everything that you've done. Make sure put it in the patient notes and everything like that. And yeah, maybe let the patient take some bandages home and stuff like that so they can do their wound at home, and teach them how to do it as well. But yeah, do you have any questions?
How long do I keep the same bandage on for?
You can keep it, well, because this wound's not too bad, it's not too pussy and stuff, you can keep it as long as you want, as you can before it gets dirty. But if it gets wet and it just seeps underneath, then change it. But if it's in good condition, then you don't have to really change it unless you see some bleeding or something like that.
Yep. And how tight do I do it on the patient?
You can ask them if it's hurting them or anything. You can also check their capillary refill to make sure that blood is still going to their fingers. Get them to wriggle their fingers, and yeah, you can just make sure that you can fit a finger in underneath this as well. But yeah, most of the time you can just ask the patient if it's too hard or not, and they'll let you know.
Thank you.